Hello, today's topic is AL amyloidosis. Honestly, this topic was a little bit difficult to understand at first, but I used this awesome book, which I've used in the past in other videos. And then chapter 86 goes very in depth with all the pathophysiology. And even though it's very technical, I think I was able to get the main ideas out of the chapter. And I created a couple PowerPoint slides, and I hope it helps others, like it helped me to understand this condition a little bit better. So AL amyloidosis is a clonal plasma cell proliferation disorder in which immunoglobulins light chains are deposited as amyloid in critical organs such as the heart or the kidneys, leading to organ failure and eventually death if left untreated. This graph right here that I added was the most helpful one for me to understand what's going on. I got it from online. Pretty much shows how the bone marrow is creating the immunoglobulins, light chains, but there is an excess of them, which causes misfolding and eventually causes amyloid fibrils, and these go to different organs and start producing organ failure. Here are some of the clinical manifestations that we can expect in amyloidosis. Those include fatigue, diarrhea, weight loss, dizziness, orthostatic hypotension, kidney issues like acute kidney injury, protein in the urine, and stiff heart, and dyspnea. These can start affecting multiple organs and eventually lead to death within 13 months if left untreated. So here are some of the things that were most like very eye-catching to me when I was reading the chapter. The chapter is huge, so I'm sure I'm leaving behind a lot of important information, but the purpose of this video is just a quick summary of what amyloidosis is. So at diagnosis, approximately 80% of patients with AL do not meet criteria for multiple myeloma. This is important because there is a lot of different types of amyloidosis. We're talking about AL amyloidosis, and this one is the one that might get confused with multiple myeloma diagnosis at some point. So this is referred to the AL amyloidosis. The diagnosis requires identification of amyloid, which is usually found in a biopsy of the symptomatic organ. So, for example, if you're having acute kidney injury, a biopsy of the kidney will demonstrate the amyloid. Another important thing that I found was that immunofixation of urine and serum is specifically indicated after diagnosis of amyloidosis has been made because protein electrophoresis often fails to demonstrate the presence of an M protein. This is also very important because in the hospital we do protein electrophoresis often. This is a very common test, but we might miss the diagnosis if we don't do immunofixation of urine and serum as well. Another important thing is that if you have a positive diagnosis, special stains might be required if suspicion of co-occurrence with MGUS. So these two conditions can occur together. So in those cases, special stains need to be ordered. The last fact is one of the, I think, really eye-catching for me, that based on published sequences of AL proteins, the ratio of kappa to lambda light chains in AL is 1 to 3, which of course is different than the normal ratio, which is 1, and from that seen in myeloma, which is 3 to 2. I thought that was very interesting. So, okay, once we have the diagnosis of AL amyloidosis, what is the treatment? I found this cool flyer from the Myeloma UK. The treatment is melphalan. Melphalan is a type of chemotherapy that is used to treat AL amyloidosis. It's a type of chemotherapy that is an alkylating agent, and pretty much what it does is that does not allow these abnormal plasma cells to continue replication. So your body has time to clear the deposits gradually without having being overloaded by new creation of the amyloids. I hope that makes sense, and I hope it helps to summarize a little bit this diagnosis. A lot more, of course, is very, very in depth. The pathophysiology is amazing, but this is just a little summary, and I hope it definitely helped me, and I hope it can help other people. Thank you.